Your cataract surgery with Dr. Devgan. Step-by-step guide to the day of surgery. So we're located on the corner of Wilshire and Almont. And you can see we enter either from the street at the green arrow or the underground parking. This is pulling up to the underground parking. We'll take a ticket and pull on into our center. And you'll go down to the B level, that's B like boy, and park your car. And we'll take these elevators up to the first floor. So it's Specialty Surgical Center, it's 9001 Wilshire Boulevard, and Suite 100, there it is. So going up in the elevator, we'll go up to the first floor, and come out, and to the side here of this water wall, that's where we see the surgery center. If you enter from the street, it looks like this. You enter through the main front doors, and again, to the right of the elevators, behind the water wall, there we go. Suite 100 Specialty Surgical Center. We're open as early as 5 a.m. You'll come on in here. Here's where your family can sit while you're doing the procedure, and you check in here at the front desk, and the staff will certainly be happy to help you. Once we're done with the sign-in, we'll be brought in towards the main surgery center, and this is the preoperative area. You can see it's a very large center. It's only for eye surgery, absolutely state-of-the-art. This is one of the largest surgery centers for eye surgery in the entire USA. So we can walk back here. My first patient's already ready for the day. She arrived here before I did. And you can see the nurses asking her the usual questions, getting prepared for surgery. Now she's wearing her street clothes. On top of the street clothes, we put a gown, but you can certainly wear your normal street clothes. We're not going to take any of those off. And then there are the drops that we'll use to help dilate the eye. And you see the nurse put some drops in too, and they'll put an IV line in there. There's the IV fluid, and check your blood pressure and all your monitors. Here's looking back towards our surgery center. This is where we do the surgery. This is the operating room area. It's absolutely state-of-the-art. This is a $10 million build-out, and it has the absolute latest equipment of all types. All the newest lasers, all the newest microscopes, all the newest robotic machines, everything. And there's my technician getting set up for the morning. And we all start very early and prepare things. Now here's Doctor for the anesthesia, and he's talking to the patient ahead of time. And the anesthesia doctor will talk to you and take care of any of your concerns. Most patients get a twilight level of anesthesia. And then here you have the surgeon, the anesthesia doctor, and the nurse all confirming with you which eye we're doing, what our goal for the surgery is, whether it's distance vision or near vision or both. And we review all these things. I will certainly be there to see you and talk to you prior to the surgery, prior to you receiving any sedation. So now we're ready to wheel back to the operating room. So we push the gurney back. This same bed that you start off on, you stay on throughout the entire procedure and even the post-op period. So we wheel you back towards our operating room. We'll all walk back together. In my hand, I actually have a towel that I've rolled up, so we're going to put that to keep your head comfortable, give you a little neck support. We value your comfort, and we want you to have a very pleasant experience. Now, at this point, the anesthesia doctor may have already given you some sedation, so you may not recall too much. Most patients, when we do the surgery, don't recall any of it. In fact, when I say that we're done surgery, sometimes patients say, well, I didn't even know you started. So here's the preparation ahead of time, positioning the head where we want it. I do put some paper tape around the forehead just to hold the head still. This will remind you not to move around. It's just paper tape, it's not too strong. And then we'll also numb the eye. It takes about 2 drops of anesthetic to numb the eye. So we put 6 or 7. The eye is absolutely numb. You will feel no pain at all during the surgery. You'll just see a beautiful kaleidoscope of lights and maybe feel the cool water. Now, most of the preparation is what we're doing now, and that often takes longer than the surgery. So the patient has only one job here, and that's to lie still and do nothing. And you can tell this patient's already received some sedation. She's already in a little bit of a twilight sleep. I'm just prepping things ahead of time, setting up our microscope. In the top left corner of the screen there, you can see the eye that we're looking at it through that microscope, and you see it on the monitor. Our anesthesiologist is covering the patient up with a blanket, keeping you nice and warm. And again, you're wearing your normal street clothes underneath here. The technician has set up these blue tables with the blue covers. Those are all our sterile pieces of equipment for the procedure. There's more numbing drops going in the eye just to be sure. Before we start the procedure, we have our nurse cleaning the eye. And we're cleaning with a special iodine-based solution. If you have allergies, we'll use a different one. And you're cleaning around the eye, so everything's cleaned to a very high level of sterility. The bottom line for this surgery is I give the same surgery that I would want to receive on my own eyes. So all patients are treated like family. So you can see my technician there with the gown on. She's putting things on our microscope, getting that set up. Our anesthesiologist is tucking in the blankets. This helps swaddle you, makes you feel a little bit more secure, and also prevents you from helping. You don't have to help at all. You just lie there and do nothing. And again, you're in a bit of a twilight state. You're breathing on your own. If we talk to you and call you by name, you'll hear us, but you'll kind of doze off a little bit here. And the entire surgery, our board-certified anesthesiologist is monitoring you. He's getting an oxygen tube here, and we'll just tape that to your chest here, and that'll blow pure, clean oxygen towards your face. Now he's putting a monitor on, and this is just stuck to your face, and this is monitoring your breathing, making sure your breathing is normal the entire time. And again, we do the same surgery that we'd want to receive. So this is the highest level. That's my technician who's putting the drapes on the eye. And these are very clean, sterile drapes, so everything around the eye stays clean. We'll open that up there. And you're breathing perfectly fine underneath, because underneath this, you have that oxygen tube towards the face. So this is now just using some special adhesive tape to keep the eyelashes away and also keep the eyelids open. You don't have to worry about blinking during the surgery. If you think you're going to blink, it's okay. You can go ahead and try to blink. You won't be able to, but it won't cause any issues. What if you need to sneeze or cough? That's okay also. Just let us know. Give a half-second notice of, hey, I'm going to sneeze. So now I'm going to have the patient look there at my hand and now look in the middle of our bright light. And again, we're still getting things prepared here for the procedure. And then for the cataract part of the procedure, the surgery, I actually take off my shoes here and I operate with foot pedals. It's like driving stick shift. 2 hands and 2 feet are needed. And I've done this surgery 20,000 times. And there we go. Surgery's over. Procedure itself will only last about 5 minutes, maybe 10 on the high end. Afterwards, we'll take off the covers. I'll put medicine in your eye and I'll put sunglasses to protect your eye. No need for any kind of patch to cover the eye. The sunglasses are sufficient. And there you go. The patient's now just starting to wake up from the twilight. And our anesthesia doctor will help me and will wheel the patient back now to the post-op area. The post-op area, we're going to monitor you for about 20 or 30 minutes to make sure you're awake and alert and doing great, and give you a sip of some juice and a snack to have. And then when you're ready, you let us know and we'll be able to send you home. Now, the day of surgery, your total time in the surgery center will be about 90 minutes, maybe 2 hours on the high end. That includes about a half an hour for the preparation ahead of time with the pre-op, the surgery including preparation, and then the post-op time as well. You can't drive yourself. You need to have someone drive for you. It's okay to use an Uber or taxi as long as you bring a friend or relative with you. We don't want you to have a 3-hour tour of LA by your taxi driver. And that's it. The patient's now awake. I'll talk to you and ask you how you're feeling and how you're seeing. And most patients are ready to go home in a very brief time. So that's a good summary of your total experience on the day of surgery. I look forward to seeing you in our surgery center and giving you our very best.